Hi Fiona, thanks for talking to me today. Can I just ask you to introduce yourself?
I'm Fiona O'Brien. I'm a GP in Annan in Dumfries and Galloway, and I'm GP lead for cancer and palliative care in Dumfries and Galloway. I also am the clinical lead for the rapid cancer diagnostic service in our local hospital.
We're going to talk about the non-specific symptoms guidelines, which I think is a new guideline. So can you tell me what's included in that?
So the guideline itself defines criteria for referral patients that don't fit into a cancer-specific pathway. These can be non-specific and result in a prolonged diagnostic interval, many visits to general practice, and often increase emergency admissions with generally a poorer outcome. It's because of this that the Centre of Sustainable Delivery supported some of the boards to develop a rapid cancer diagnostic service to provide primary care with a pathway to refer these patients with the symptoms into. So the symptoms are usually unexplained weight loss, fatigue, abdominal pain or bloating, nausea and vomiting, non-specific pain, and largely the gut feeling of an experienced GP. Not all the boards at the moment have a rapid cancer diagnostic service, but those that don't have GP direct referral to CT. So these guidelines can also be used as a lever to identify the people that would be best referred for a CT.
The guidelines split into assessment and referral sections. What's in those sections? Is there guidelines on things like what percentage weight loss is significant, what blood tests you're concerned about?
So the assessment is basically a list of primary care investigations undertaken prior to referral. They include urinalysis, full blood count, yearly liver function test, thyroid function test, hemoglobin A1C, bone profile, either a CA125 or a PSA. We've included blood-borne viruses recently, vitamin B12 and folate, and some local guidelines may include a chest X-ray. We do suggest that people refer to the local guidelines because they can vary from board to board. With regard to the referral, weight loss is deemed to be 5% or more of the weight in the last 3 months, are indeed a strong clinical suspicion. The other referral criteria would be new unexplained loss of appetite or fatigue or nausea or malaise or bloating, and it's recommended that these symptoms are going on for 4 or more weeks. There's also new unexplained, unexpected or progressive pain, which includes bone pain, and again we say for 4 weeks or more. There's also a symptom combination, which could include several cancers, because obviously if we feel there's more than one cancer going on, they're probably best seen in this rapid cancer diagnostic service. And the final one would be abnormal blood tests, for example, unexplained, unexpected anemia or thrombocytosis.
And does it include, because I know we've in the NICE guidance from 2015, there's some referral criteria for unexplained DVT, which has been a bit contentious. Is that included as well?
So unprovoked DVT on its own should not prompt referral. We scrutinised all the evidence, and on its own, unprovoked DVT does not equate very greatly with a cancer.
You've also got a section on good practice. What's included in that section for the non-specific symptoms?
Well, the good practice points stress the importance of informing the patient that this is a cancer referral and relevant documentation of that, and also including their functional status. Now, being frail is not a reason not to be referred, but it is useful for the clinician to have that idea before they see the patient. It also details considerations around bone pain, in particular the malignant spinal cord compression, and signposting to the local guidelines on that. Suggest also the unexplained thrombocytosis. They say perhaps a chest X-ray would be worth considering prior to referral, having already considered GatewayC as a strong indicator for cancer of the lung, endometrium, stomach, esophagus, or colorectal. GatewayC was stressed in the last guidelines, which were published in 2019, as a general good practice point.